Well, summer's almost here. That means you're probably spending more time out in the sun, especially because the temperatures are almost perfect. So here talking health with us this morning is Dr. Scot Ackerman from the Ackerman Cancer Center. Good morning to you.
Good morning. Good to be here today.
Thank you. So skin cancer, most common cancer in America. We know it can be deadly, but it's also 100% preventable. You need to catch it early, though. So what are the different kinds of cancer when it comes to skin cancer, and are some more dangerous than others?
Right. As you said, skin cancer is the most common cancer of Americans. We don't talk about it a lot because most of the time it's not deadly. So when we talk about lung cancer and breast cancer, we refer to that group as the non-skin cancers because skin cancer is so prevalent. But there's over 5.4 million skin cancers every year diagnosed in the United States. And there's three main types: squamous cell carcinoma, basal cell carcinoma, and malignant melanoma. And of those three, malignant melanoma is a very serious one, and there's a significant number of deaths with malignant melanoma. So of those 5.4 million, 75,000, a small percent, are malignant melanoma, but they account for 75% of the skin cancer deaths and really account for about 10,000 deaths a year because of melanoma.
Wow. You know, we all know someone who's had to, go to the doctor, get a spot removed or checked out. What should people be looking for to say, oh, this is a red flag, I need to see the doctor?
So we talk about these things called the A, B, C, D, E's of skin cancer and of lesions you might see in your skin. So A is asymmetry. If the lesion at one side is a bit larger than the other, if there's some asymmetry in it, that's concerning. B is the border. If the border is smooth around a mole or smooth around a spot, that's not to worry about. But if the borders are irregular or scalloped, that's a cause for concern. C is color. If the color is nice and uniform, that's good. If the color is heterogeneous, there's some darker areas or lighter areas, maybe still a little bit of red in it, that's to be concerned. D is diameter. And the diameter we talk about is a large lesion is more concerning than a small lesion. Large lesions are more associated with cancer than small lesions. So anything greater than the size of a pencil eraser is concerning. And then E is evolution, evolving. If the lesion is growing or changing, evolving over time, those are lesions that are concerning as well.
You know, we know fair people are more susceptible to the sun's rays, but, darker skinned people also do need to wear sunscreen. But there are some people who are more susceptible.
So those people that are more susceptible aren't just fair-skinned people, but people that have a family history of skin cancer, people that may be immunosuppressed, there's some sort of immunological disease. We see transplant patients, people that have kidney transplants or liver transplants because of that immunosuppression that weakens their immune system, and that puts them at a higher risk of developing skin cancer. And also, we see skin cancer, associated with melanoma, more associated with people that get very intense sunburns in life, as opposed to people that are constantly out in the sun. Those people that are constantly out in the sun and get sun exposure usually get the non-aggressive cancers like squamous cell or basal cell, but those that get these large bursts of skin burns are more associated with melanoma.
All right, keeping an eye on our skin. Thank you so much, Dr. Ackerman, for talking with us.